You've had a baby. Now what? Hi everybody, welcome back to my channel. I am so excited to be back. It's been 9 weeks since I've been gone. For those of you who do not know, I had a baby 9 weeks ago, so I've been away from the channel for some time to adjust to the new change, because I do have another baby who's 17 months old and I feel like I'm getting the hang of things. So I am back now. I don't know how consistent I will be able to be, but I will try my best to be as consistent as possible. And yeah, when I left, we were on road to 500 subscribers. I'm back and we have reached that milestone. Thank you guys so much. Welcome to all our new subscribers and to all our returning subscribers. You guys are so awesome. I appreciate you guys so much. So as you've seen by the description, today I'm talking all things newborn babies. So I've shared my journey with you guys. I shared from discovering baby's gender to I shared every stage of my pregnancy. And now I feel like when it gets to the point, like after you've given birth, you've left the hospital, that stage tends to be neglected, and that is the stage that is the most demanding from new parents. Last year when I had my son, I was a first-time mom. I don't have parents, I don't have siblings, so that journey was very overwhelming. I felt I needed a firmer support system, and you know what, I feel I want to be that support for a new mom watching this from wherever you're watching from, you know. And I when I was pregnant, I read a lot. I knew what was happening with my body, so nothing overwhelmed me. As different stages of pregnancy came, I was prepared for it. I understood what was happening for my body, but I did not do the same for life after baby is born. I did not prepare for that. I did not gather information for that. So when it came, it caught me off guard. It overwhelmed me. I was not coping, and I don't want moms to go through that. Hence, I'm hoping to reach as many new moms as possible through this video, and they learn all these basics for caring for baby. I believe they will make a huge difference. I believe they will help new moms. So yeah, let's get right into the video. So the first thing I want to discuss is that you might not fall in love with your baby right away. You might not fall in love with your baby right away. I know that sounds weird, especially given the fact that in movies and everywhere we always see these clips where a mom gives birth, they put the baby on you and it's instant love at first sight. It might not be the case. It wasn't the case for me with both my babies, and it's very easy to feel very bad for that, but it is normal. It is normal. It is normal for you to fall fonder of your kids as your bond with them grows. It is very normal. There's no need to feel bad for it. The only time it should concern you is if it's going on for weeks and weeks and weeks and you just feel disconnected from your body, from your baby. Then you should consult your doctor, because chances are you have postnatal depression. Okay, the second thing I want us to talk about is that babies cry. Babies cry, okay? Babies cry, and it is okay. It is okay. I know you are made to feel bad for your baby crying so much. I know most of the time, everybody that would call to talk to me after I had a baby, the two questions they would ask is he sleeping? Does he cry a lot? As if it's something bad, you know. Babies cry. It's what they're supposed to do. The only time it should concern you is if they're not, because that is their way of communicating to you. Because let's be honest, this person is transitioning to a whole new environment. They had been staying in the comfort of your womb's embrace for 9 months, where their need was met instantly. They were hungry, it was met. They were cold, they never felt hot or cold. They never felt a lack of security. They were just at this place where their need was met as it arises. Everything was instant, and for the first time they start to experience either feeling hot or cold. They're starting to experience hunger. For the first time they're starting to feel you away from them, because as far as babies are concerned, you guys are one. Do you know that your baby needs to learn that you guys are two separate individuals, and that's a big thing to transition into. It's a big deal for them. Hence they need comfort, they need you to hold them. And that's another thing I know, especially as Africans are taught, no, don't hold your baby so much, you're spoiling them. There is no way to spoil a newborn baby. Please hold your child as much as you feel is necessary. And their tears are not to manipulate you. I know some people believe babies cry to manipulate the parents. It's not. What does a newborn baby know about manipulating? So hold your baby as far as you feel is necessary. You are helping them transition into their new environment. You are not spoiling your child. Okay. Another thing that I want to talk about is possible reasons why a baby could be crying. Okay. Your baby could be crying because they are hungry. Your baby could be crying because they are overexhausted or they are sleepy. Your baby could cry because they need a nappy change, and your baby could be crying because they need what is called winding. And going further into the video, I will be explaining each of these in details. So, being hungry. I want you to be aware of the fact that babies feed very frequently. When a baby is born, their small stomach is the size of almost your teaspoon. It's between 5 milliliters and 7 milliliters. So they feed often. It's quick to fill and it's quick to get empty. It's so small that it needs to be filled regularly. So do not be surprised. Be prepared for the fact that your baby will be feeding often. It can be demanding on the mother. It can be exhausting, but it is perfectly normal. Another thing I want to talk to you about is that the first milk that will come through is not normal milk. It is something called colostrum. Colostrum is a more concentrated type of breast milk. It comes out like in drops. It comes out in drops. Don't let that concern you. Don't think that there's something wrong with your supply. It's normal. Before your normal milk comes through, the first few days, all that will come out is colostrum, and colostrum is enough for your baby. It meets all the nutrients that your baby needs. You don't have to supplement with anything. Okay. And then if you feel that your supply is concerning and you feel like, oh, your milk is not coming at all, foods that you can eat is oats. You can drink a lot of rooibos tea. There are also lactation cookies that they sell. I know here in South Africa, one of the most recommended brands is a brand called Mrs. Milk. And if none of that is helping and you're really concerned with your supply, there are also lactation consultants that you can consult to check what is happening and how that they can help you. Don't be quick to give up on your breastfeeding journey if it's something you really want. There is help. Sometimes the only thing between you and a good supply is the relevant information. Okay. And then another thing that you need to know is breastfeeding in the first few days is painful. It is very painful. Okay. And it's different from people to people, from person to person. I remember with my son, it was extremely painful for me as a first-time mom. And I was nervous going into it the second time, this time with my daughter, because I was expecting the same experience, but it was completely pain-free this time. But yeah, be prepared for it to be a bit painful, and don't let that be a reason for you to give up on breastfeeding. It does get better as the days go by, and the pains don't last very long. The first pain that you will feel is the discomfort from your nipples. Okay, and it is perfectly normal, and most of the time what causes that is the fact that baby is not latching properly. I just want to call you, and I just want to show you this. Let's say this is your nipple. I don't know, let me hold it here. Let's say this is your boob, this is your nipple, right? I used to think that baby just needs to suck somewhere on the nipple and milk comes out. But truth is, your milk, you don't have just one milk duct from which milk comes out. It is multiple ducts around your nipple. So you have the area that surrounds your nipple, that area that looks like your nipple, that surrounds it on the boob, that's called the areola. And so your baby needs to latch around your nipple all the way to the areola. When your baby is latched this way, it doesn't hurt for you. But if they latch only here and they keep pulling on your nipple, it causes your nipple to crack and it's very painful. So one thing you need to know, your baby needs to suck not like this, but like that. Okay, so that's another thing that I didn't know as a new mom. Another thing that causes the pain in breastfeeding is that each time your baby breastfeeds, your womb contracts. So it feels like those, it reminds you of labor because it feels like milder labor pains where your womb is contracting and it's going back to its normal size. That too will last only a few days and it will go away. So be patient and be prepared for it. It's very uncomfortable, but it does go away after a short while. Okay. Another thing that you should know is that your nipples might crack. You might literally crack, or you have cracks on your nipples, and you can treat that by applying nipple cream. I have mentioned a nipple cream that worked for me and that I recommend in my hospital back video. I will link that video at the end of the video, or even I'll suggest it right here in this part of the video so that you guys can watch that video as well. It's very informative. And then my other advice for you is to always have nice ready and easy healthy prepared snacks next to you when you go to bed. Okay, you can have your fruits or your snack bars or whatever you enjoy that is readily there next to you, next to the bed, or wherever you nurse baby from at night, so that you don't have to keep getting up to go get something to snack on, because breastfeeding does increase your appetite. Because you are producing milk, you constantly have a need to snack. So if you have something there ready, you can just grab and eat as you nurse or after you have nursed, without having to get up. Because also remember, your body will still be healing from you having given birth not so long ago. Okay, and yeah, another thing that takes us into our next point is when babies nurse. Remember, the first 6 months your baby's diet should be a liquid diet, which means your baby is either breastfed or they are formula fed, depending on your method of preference. Um, but either way, however your baby is being fed, they swallow air. Right, the air that they swallow creates a lot of discomfort for them in their stomach, and the way to prevent that is a method called winding. What winding is you petting your baby in different, there are different ways to do it to help your child release the air. Okay, so your aim when it comes to winding is to wind as quickly as possible after a feed, so that the wind can go up and come out via a burp. Because if you don't do that, it will want to come out the other way, and that can be very painful for them. Okay, so you wind your baby. A method that works for me is holding my baby on my lap, petting, and then I make my hand into a V like that, and then I put my hand on my baby's jawline and just pet the back, and that helps get the wind out. Another method is putting baby, a very common method, that's right, putting baby on your shoulder and just pet your baby that way. And then another method is for you to rub your baby in circular motions clockwise. Another one that you can do, if all of these methods do not help, is to lay baby flat and help and hold baby's feet and roll them into bicycle motions to help release the air the other way, because it means the air has gone down and needs to come out the other way. So you just roll your baby's feet in circular motions. And then another thing that you can do is to hold your baby's feet the same way and just press down and press the feet onto the tummy. You will see how that helps release the wind almost instantly. And another thing with winding is that it can take time. You can be patting and patting and patting and it just doesn't come out. I've watched a lot of videos and they make it seem so easy, but for us, for me and my husband, we really struggle with getting our kids to wind. So yeah, that's another thing that you need to be aware of. And then another thing that you need to know about winding is that babies can spit. They can have what is called spit up when they are being winded. So you have your baby, you petting them, and when they burp, they can have what is called spit up, and it is commonly known as a wet burp, where you petting your baby, and when they burp, they just let some of the milk out. And what you need to know about that milk is that it can come out either through the mouth or the nose. Don't let that concern you. Don't be out here like, oh, my child is vomiting through the nose and panicking. It's okay. It's perfectly normal. Okay. And then our next point is baby sleeping position. What you need to know, and a lot of Africans are going to disagree with me for this, especially our moms in the older generation, but your baby needs to sleep on their back all the time. That is the safest sleeping position for your baby. It minimizes the risk of SIDS. It's short for sudden infant death syndrome, where babies die in their sleep. And there's a whole science behind it, but the best way I'm going to explain it, how I understand it, is I compare it to my basin. You know your basin in your bathroom where you wash your hands? Here's your basin, right? And it has that pipe that releases the water. Yeah? If you pour water into your basin and the pipe is it's open, it's not closed. If you pour water into it, what does it do? It sucks the water right up and the water goes down. I imagine my child like that. Baby is sleeping facing up. If babies vomit in their sleep, the vomit will go straight down into the same opening and they will swallow right up without choking. But if you were to make your basin lie on its side or tilt it and you pour water, what will happen is the water will remain in the basin and it will come out. The same happens with your baby. If they are sleeping on their side and they vomit, they can that vomit will come out and it will fill the mouth, come out through the nose, and it can block your baby's air passage. So always babies sleep on a flat surface on their back, and always make sure that all those cute pillows that we decorate our cots with come out. All of that is out of your baby's cot. Your baby doesn't need all of that, because if that can touch your baby's face and block them from breathing, they are too young to think that, oh, I need to remove this in order to be able to breathe again. So there shouldn't be any of fluffy pillows, teddy bears, all of that shouldn't be in the cot. Okay, and then the next point, nappy changes. Nappy changes. What you should know with newborn babies is that because they feed frequently, they need frequent nappy changes. Okay, let that not surprise you. let it not think that there's something wrong with your baby. It is normal. And then another thing is the very first stool that your baby is going to pass will be black. Yes, your baby's first nappy will be full of this gooey, sticky black thing. Okay, that thing is called meconium. What meconium is it consists of all the things that baby was swallowing during their development in the womb, and it creates a lining around their intestines. So once they are brought into the world, they release that, and it comes out in their stool, and it lightens as the days go by. It doesn't last very long. It goes from the black to like a dark green, and then it goes and transitions to a bright yellow color, and that is the stool that you'll have for some time. I think until baby starts their solid food. Okay, and it's perfectly normal. The best way to clean it up, I learned that this time. I didn't know it with my son. You know, there's wet wipes, but once it's still the meconium, because it's very sticky, it's very difficult to wipe off. But if you take a cotton pad and drizzle some baby oil on it, it wipes it so easily. So that is a nice hack that you can use to clean your baby off of the meconium. And then another thing that you should know is that with breastfed babies, they might not have dirty diapers daily. They might not have dirty diapers daily, and it is perfectly normal. Okay, I know we tend to want to measure that our children are feeding well by how frequent we change their diapers. But if it is not daily with breastfed babies, it shouldn't surprise you. It is perfectly normal. How my midwife explained it to me was, breast milk is natural, so as baby takes it in, it gets absorbed into the body, so it does not always need to be released via passing stool, as opposed to formula, which is processed. Okay, so that is another thing. Don't panic. It is perfectly normal if your baby is not getting dirty diapers every day. As long as you are getting wet diapers, nappies, then you are perfectly fine. Okay, and then another thing that you should know, you should always wipe from front to back. Always wipe from front to back, especially in girls, to prevent the risk of infection. Okay, another thing you should know with baby girls is that they might have a translucent or a creamy discharge in the first few days that has the traces of blood. Is different. It is perfectly normal. A bloody discharge in girl children in the first few days after being born is perfectly normal. Let that not freak you out. Okay, and then another thing you should know is that once you open your baby's nappy and the cold air hits them, they tend to pee. They tend to pee. It's perfectly normal. So the one way you can handle that is by putting a clean nappy under the one that you're changing, so that when they do pee, they pee right through to a diaper instead of the area you're changing them on. And then another way you can help to minimize that or to prevent it is take a wet wipe baby's lower belly area, and so that with a wet wipe, so that they release before you open the nappy. Okay, because with boys, if you experience that, then the pee goes right up, and it can go to your clothes, it can go to your face, it can go either way. So try wipe with a wet wipe before you open up, and yeah, to avoid experiencing that splash. And then another thing that you should know related to nappies is your nappy should never cover the umbilical cord stump. It should never cover it. Your most newborn baby nappy brands, when you buy them, they have an area already cut out for where the umbilical cord stump is going to be. But I have found that those cuts are too small. So what you do then is you fold your nappy in and make sure it is placed right under the belly button and not covering your umbilical cord stump. Which takes me to my next point. I want to discuss the umbilical cord stump itself, how to care for it. Number one tip, leave it alone. Leave it alone. Do not tamper with it. It will fall off on its own. Okay. And another tip that I fell victim to, do not be pressured into being made to feel like it's taking too long to fall off. I remember there's a certain relative who used to ask me every time they called, has it fallen? Has it fallen? They would literally call every day to ask if my child's umbilical cord stump has fallen. And by the fact that it hadn't yet, it made me feel like that maybe there was something wrong with my child's development, which was just unnecessary pressure, honestly. So don't allow yourself to go through that. It will fall. It can take up to 3 weeks, so do not be concerned. It will fall off on its own, as long as it's not showing any signs of infection. If there's no bleeding, there's no pus, then you have nothing to be worried about. Okay, and your aim with it is to keep it dry. That's why we don't want the nappy covering it. Your aim with it is to keep it dry at all times. It is advised, I know in many South African hospitals they advise that you use a cotton pad and some surgical spirit to clean it, but a method that really worked for me in cleaning it was using witch hazel. Witch hazel is a natural ingredient. You find it at any pharmacy, and it was great because it really helped to dry it up. I really I got to experience both, and I really preferred the witch hazel over the surgical spirit for me. And then another thing is, how do you bath baby when they have this thing hanging? It is recommended that you do sponge baths until it falls off. You just buy those sponges that you use to bath with, dip that in water, squeeze it dry, squeeze it, and then just tap your baby clean. There's really not much to it, and it allows you to clean nicely around the umbilical cord stump without getting it wet. Okay, and then talking about baby's bath, there is something called Venix. Venix is a white, creamy thing that baby is born with on their skin. Okay, it is waxy, it is very greasy, it is not a pleasant sight, it doesn't smell very good, but it is very beneficial for your child's skin. They used to have much more of it when they were in the womb because it was protecting their fragile skin from all the water that they were living in. So you want to keep it on baby skin for as long as possible. Don't tamper with it, don't scrape it off, don't wipe it off forcingly. It will come off on its own. Just leave it, it will come off on its own. Okay, and another point I want to discuss is babies tend to have a blocked nose, and they tend to sneeze a lot as newborns. Don't let that come as a surprise. Your baby is not sick or they didn't contract anything. It is perfectly normal. Their nostrils, their whole the whole nose area is much smaller than ours, and it gets clogged by a lot of things, breast milk included. Remember, they spit up and it can go through the nose, and all the mucus, all the all the things that could have gotten in the nose while they were still in the womb, all of that can block their nose. And the best way to handle that is through putting some breast milk in your baby's nose, because you will find they breathe with difficulty. It sounds like that. But all you need is to hand express some breast milk. How I did it, because it's very difficult to express right directly into the nose. So what I used to do, I used to express my milk into a small container, and with a syringe take some of the milk and spray into each nostril like this. Another thing is that if your baby has an explosive nappy, which they will, baby vests are designed with envelope shoulders, which enable you to roll it down and take it out through their legs, instead of you pulling in all that explosion on your baby's face. You don't want that. Most baby nappy brands now come with this line over here, and what this line does is it tells you if a baby's nappy is wet. So if it's dry, it will be yellow, but if it's wet, it turns blue. So that saves you a lot of time. You can always just pick to see the line instead of undressing baby to check and dressing them again. It is until I was editing that I realized that my camera had stopped recording at this point. I am so sorry for that. But a few things that I had said in conclusion to the video was, keep your child's baths quick, as their skin is very quick to lose moisture. And if the idea of caring for an umbilical cord stump freaks you out like it did with me, be mindful of the fact that it doesn't hurt. You are not hurting your child. Think back to after you had given birth and they were cutting it. You didn't feel it, neither did baby, because it doesn't hurt. Think of it as cutting your hair or cutting your nails. It has no nerves, but it is connected to live tissue, so do treat it with sensitivity. And I know that throughout the video, I was speaking in support of moms that either breastfeed or formula feed, because I understand that there are so many factors that can contribute to a mom choosing not to breastfeed, and I respect that. I do, however, encourage breastfeeding because it is the best nourishment for your baby. And enjoy the newborn stage. In no time, your child will want to be on the floor exploring their environment. So embrace them, hold them for as far as you feel is necessary. Okay, mama? You're not spoiling your child. And motherhood doesn't come with a manual. It's all about trial and error. Acknowledge that you are doing your best. Acknowledge that you are doing great. And on days where you couldn't tick off all the listed things on your to-do list, acknowledge and fix your attention more on the things that you were able to do, other than the things that you were not able to do. If there's any moms watching this video and you feel that there are tips and tricks that I didn't mention that can help new moms, kindly let us know in the comment section and let us learn from each other. With everything said, please acknowledge that I spoke not as an expert, but it is merely a mom's perspective. In conclusion, congrats, mama. Congrats on either your pregnancy or your baby. You are gonna do so great. Thank you so much for watching. Please share the video with other moms. I love you guys so much. God bless you. Until next time. Mwah.